Good afternoon, I'm Dr. Ananda and I'm an orthopedic surgeon from Orthocare, Orthopedics and Sports Medicine. We are located at Mauni Novena, Farrer Park Hospital and Parkway East Hospital, and today we are talking about ankle sprains.
How common are ankle sprains in Singapore and what typically brings patients to seek your care?
Okay, so ankle sprains are relatively common as a sports injury, and typically one of the reasons why patients come to see me is usually they have tried measures by themselves such as resting, ice, some form of compression and elevation, but the swelling and the pain still persists after about 10 to 14 days, and that's when I see usually the patients who come to see me for this common injury.
How long can ankle sprain pain last? And what are the recommended treatments?
So the most mild form of ankle sprain is when the ligament of the ankle is just stretched beyond its usual limits, but it's not torn. In patients such as these, the ankle injury usually lasts for maybe a week or so, and they are able to get back to their activities quite quickly. However, if there is a tear of the ankle ligament, which could be a partial tear or a complete tear, usually the pain and the swelling tends to persist for more than 14 days. So some of the measures that patients may have done to actually help to alleviate the pain would be some form of resting, icing, some form of compression of the ankle guard, elevating the leg. These measures tend to help to reduce the pain. Of course, they may have seen a primary care physician or a GP who may have prescribed some anti-inflammatory medications, which also tends to help the swelling and the pain that these patients face. If the pain does persist for more than 14 days, typically it is advisable for the patient to seek a specialist opinion because there may be more injuries such as maybe a undisplaced fracture or a hidden fracture that may be missed.
What are the common treatments for ankle sprains and what is the typical recovery time?
The treatment for an ankle sprain depends on the severity of the ankle sprain. So if an ankle sprain is deemed to be a mild ankle sprain, we can usually treat these patients with some conservative treatment measures such as analgesia for pain relief and inflammation suppression, icing, resting the ankle, and of course starting early physiotherapy to help to strengthen the ankle muscles and also to teach the patients a sense of proprioception and balance. However, some ankle sprains are a bit more severe. Sometimes they are better served with a small keyhole procedure to help to repair the ankle ligaments that are torn. The typical recovery for these procedures is usually about 6 to 8 weeks.
Are there exercises to prevent ankle sprains, relieve symptoms, or aid recovery?
Ankle sprains typically happen sometimes in patients who are involved in sports that are requiring a lot of twisting movements or sudden changes in direction. What usually would help them before even getting these injuries, maybe some training of proprioceptive balance exercises and reflexes. If let's say patients develop ankle sprains not from sport but maybe from typically walking and maybe missing a step or some accidents, sometimes footwear is also an important aspect to consider because wearing the proper footwear in a proper situation would actually help to prevent injuries because you will get better support for your ankle to actually prevent these injuries from happening. Now, exercises that generally will be useful to actually give ankle more strength to actually prevent these injuries will be exercises that improve the strength of the peroneal muscles, which are muscles that are very, very close to the ankle ligaments that help as a secondary stabilizer to the ankle joint. And the other aspect of the exercise which I've mentioned previously is also a sense of balance and proprioception, which is basically how the ankle can actually help to balance itself when it's on uneven terrain and how the muscles can be activated to prevent injuries such as an ankle sprain.
How effective are tapes or bandages in relieving symptoms or aiding ankle sprain recovery?
Yeah, so supportive tapes and bandages are certainly helpful as a form of compression, especially when we talk about bandages, which are usually what we call sometimes something called Jones bandage, which is usually initiated in the initial stages of an ankle injury. These bandages provide some form of stabilization and support and compression of the joint to help to reduce the initial swelling. However, once the initial phase is over, we would usually advise patients to start physiotherapy, which will involve range of motion exercises. Basically, that is to help to improve the musculature. Now, taping itself is a modality that's usually used by physiotherapists and sports medicine physicians to actually help the stability of the ankle joint to prevent injuries, especially when they're recovering from an ankle sprain. Now, these sports taping, as usually there's a certain technique that is involved in doing it, and it's best that it's being done by a qualified physiotherapist who can actually do it in a proper way to actually help to stabilize the ankle before the patient engages in some form of sport again.